Can you have pelvic floor issues without incontinence? Fabulous question. 100%. Um, and I will say that a lot of our first time moms are like, I don't pee my pants. I'm great. I don't pee my pants. And then they have their second baby. They're like, why do I pee my pants now? Um, and it's often because they had pelvic floor issues, but because they didn't have the incontinence, it wasn't diagnosed and they didn't do the work in between, which set them up to have a weaker or tighter pelvic floor moving into a second pregnancy. And we do know that multiple pregnancies tend to be at higher risk for pelvic floor dysfunction. So these are the people that I really start to question, right? Do you have back and hip pain? And back and hip pain that isn't resolved with a normal strengthening or stretching protocol? Are you somebody who has painful periods? I mean, I can tell you a zillion women who've had painful periods their whole life. And because of the narrative and the failure to discuss this more, have just expected that's what it's supposed to be. Do you have, I see a lot of women who have a lot of downward pelvic pressure. And again, if it's unremitting, if it doesn't change with postural position, things like that, that can be a pelvic floor dysfunction too. So yes, 100%. None of these symptoms, it's not a catch-all. You don't have to have all of them. You can have one of them. You can have, none of them now, but some of them later. So yeah, that's why we go through that full list. But you don't have to have incontinence.